Hi there. If you're a man over 40 and your energy and strength and drive aren't what they used to be, stay right here because nothing is more important than fixing the one hormone that controls all of it, and that is your testosterone. Hi, I'm Terry. I'm 64 years old, and I help men in their 40s, 50s, and 60s reclaim their strength, confidence, and vitality they thought they lost. I create science-backed content on hormone-focused nutrition, muscle building and strength training, sleep and recovery optimization, stress management, and anti-aging strategies. I'm living proof that it's never too late. I feel stronger and more fired up now than I was in my 30s actually, because I follow the same methods I teach here. On this channel, you'll learn exactly how to restore your testosterone naturally, rebuild muscle, cut stubborn body fat, and sharpen your mindset so you feel like a powerful and capable man again. So if you're ready to take back control of your health, your physique, and your life, you are in the right place. Now let's jump into today's video, and that is how to measure and monitor your testosterone and hormone levels, the 7 essential blood tests. So let's go. In this video, I will provide you with a comprehensive understanding of the role of testosterone in men over 40 and how to measure and monitor your current hormone levels by taking these 7 essential blood tests to establish your baseline hormone level. And finally, what constitutes normal levels for your age. I also discuss the role of testosterone in your overall health, symptoms of deficiency, and of course the specific blood tests and lab measurement methods to establish your hormone baseline. You'll need to understand the fundamental aspects of testosterone, including its role in men's health and what constitutes normal levels for your age range. We will look at the symptoms and signs of low testosterone and the testing methods, of course, and how to monitor these changes over time. So let's get started. Here's our medical disclaimer, and it's just important to note that your medical practitioner should always be consulted before beginning any new program that involves exercise, nutrition, wellness, or health. So testosterone is a crucial hormone for men's health, and it becomes particularly more important as we age. Understanding its functions in normal age range levels is vital for recognizing potential health issues. Testosterone plays a vital role in many bodily functions. In particular, muscle mass and bone density. Testosterone is crucial for the development and maintenance of muscle mass and bone density, contributing to your overall physical strength. Fat distribution. Testosterone influences the distribution of fat in your body, impacting body composition and again, overall health in men. Libido and mood. Affecting libido and mood, testosterone plays a significant role in sexual health and emotional well-being in men, making it essential for overall well-being. So here I'm going to show the variability by age of the normal testosterone ranges. Obviously, as we grow older, the ranges will change. They'll get tighter to the lower end. But I'm showing here both testosterone, total testosterone levels, along with your free testosterone levels. And it's important to note that your free testosterone levels are more significant to analyze than your total testosterone levels. Your total testosterone can hide certain issues that you may have. Your free testosterone is the one to pay attention to, though. Your normal levels here for adult males, normal testosterone levels are typically considered to be between a wide range here of 300 nanograms per deciliter to 1,000 nanograms per deciliter. But in reality, it's tighter than that to the lower end. And you'll see here, I'm giving a range from 40 to 70. So take a look at this. When you go to see your doctor to get your hormonal blood panel done, you'll have an idea of where your range should fall. And it'll give you a better idea of where you're at and where you should go moving forward. So consult with your healthcare professional, get your blood panel done, and take it from there. Low testosterone can lead to various symptoms that affect your daily life and overall health. This is where it starts. Recognizing these signs and symptoms is crucial for a timely intervention. Now here are the physical symptoms of low testosterone. This includes fatigue. That's the first thing you'll probably notice. Your low testosterone levels can lead to persistent fatigue. That is a fatigue and a tiredness that affects your daily activities and your overall energy levels. And this is when you feel tired all the time and you really don't know why. The next one is reduced muscle mass. This goes without saying, so as we age, we tend to not be able to maintain our muscle as easily as when we're younger, obviously, but individuals with low testosterone may experience a decrease in muscle mass impacting strength and physical performance. The next one is increased body fat. You'll notice that as we age, if you don't do anything, your body's composition starts to change. Your muscle starts to be replaced by fat. So low testosterone can contribute to an increase in body fat, particularly around the abdomen, affecting your overall body fat percentage. Decreased bone density. A decline in testosterone levels may lead to decreased bone density, and that increases the risk of fractures and osteoporosis. These signs can significantly impact the quality of your life and your physical capability, so it's important to take notice. There is another symptom that you should notice that strikes at the very heart of us as men, and that's a diminished sexual drive. So that's a whole other topic, but for now, just consider that a symptom as well. Low testosterone also affects your mental health. Men with low testosterone may experience mental and emotional symptoms, and addressing these symptoms is vital for maintaining mental health. These include mood swings. Men with low T experience often significant mood swings that can affect your daily life and relationships that are unexplainable, seemingly. Depression symptoms. Low testosterone can lead to feelings of depression, impacting your overall mental health and quality of life. Anxiety and lack of motivation. Decreased testosterone levels can result in increased bouts of anxiety and reduced motivation, hindering your day-to-day activities and the ability to achieve your daily goals in life. I will now break down the 7 essential blood tests that you need to establish your hormone health baseline. Blood tests are the most common and reliable way to measure testosterone levels. A healthcare professional typically performs these tests drawing blood from a vein to assess the hormone levels in your bloodstream. These blood test results provide crucial information for testosterone health evaluations and help to determine your plan of action. By the end of this video, you'll know exactly what to ask your doctor and how to interpret your results. So let's dive in. Number 1 is total testosterone. Number 2 is free testosterone. Number 3 is sex hormone blinding globulin, which is your SHBG. Number 4 is your estradiol, which is E2. Number 5 is dihydrotestosterone, that's DHT. Number 6 is luteinizing hormone and follicle stimulating hormone, LH and FSH. And number 7 is prolactin. So now I'll talk about each one of these tests individually. So first up is total testosterone. This measures both bound and free testosterone in your blood. Think of it as the big picture number. But here's the catch. A 2024 study found 30% of men with normal total testosterone still had symptoms because their free testosterone was low. That's why you need to pair the test for total testosterone with the test for free testosterone. So the commonly accepted normal range for total testosterone is 300 to 1,000 nanograms per deciliter. Optimal for men over 40, though, is in the 500 to 800 nanograms per decibel level. Next, it's free testosterone. This is the active hormone your body actually uses. Optimal range is 15 to 20 nanograms per deciliter. If it drops below 5 nanograms per deciliter, you'll start to feel fatigued and you will lose your edge. A pro tip is ask for an equilibrium dialysis test. It's the gold standard for accuracy. A 2025 study linked low free T to a 40% higher risk of heart disease in men over 50. So don't skip this test. Next, we have sex hormone binding globulin. That's SHBG. This is considered the gatekeeper that locks up your testosterone. If you have high SHBG, that's greater than 50 nanomoles per liter, you'll have less free testosterone. If you have low SHBG, that is less than 10 nanomoles per liter, this could mean insulin resistance. And by the way, nanomoles per liter measures the level of concentration in your blood. So low SHBG, that's less than 10 nanomoles per liter, could mean insulin resistance. And the way to fix this is obviously you got to reduce your carbs. So go on a low carb diet and start with zinc supplements as well. A 2023 study found low SHBG predicts metabolic syndrome, which is a cluster of 5 medical conditions, and they're all bad, such as high blood pressure, high blood sugar, and high serum triglycerides, just to name 3. So balance your SHBG and you'll unlock more usable testosterone. Okay, number 4, we have estradiol, otherwise known as E2. And just to note, this is not just a female hormone. Men need it for bone health, but too much causes gynecomastia. And yes, guys, that's man boobs. And as well, mood swings. So keep E2 between 15 to 30 picograms now per milliliter. A 2024 study showed that men with E2 over 35 picograms per milliliter had double the risk of prostate issues. So if your E2 is too high, ask your doctor about aromatase inhibitors. They're commonly used, these commonly used AIs, as they're known for men, include anastrozole, letrozole, and testolactone. Okay, number 5 is dihydrotestosterone. That's DHT. This fuels your male traits, but can wreck your hairline and your prostate if it's too high. So aim for 40 to 60 nanograms per deciliter. So if your DHT is too high, you can try saw palmetto. That's a herb that might help, but eventually you're going to have to consult your doctor for other treatments. A 2025 study linked high DHT to prostate growth in men over 60. So take this one seriously. So number 6, we have luteinizing hormone, otherwise known as LH, and follicle stimulating hormone, which is FSH. In males, luteinizing hormone stimulates testosterone production and FSH stimulates sperm production, which are different cells in your testes. LH and FSH are your pituitary messengers. Low levels, less than 1.8 IUs per liter, means your brain is not signaling your testes properly. In fact, 15% of low luteinizing hormone cases in men over 50 are due to pituitary tumors. So do not ignore these biomarkers. And finally, number 7 is prolactin. And yes, guys, this is the breastfeeding hormone. This can crush your testosterone if it's too high. So you need to keep it under 10 nanograms per milliliter. A 2025 study found that levels over 20 nanograms per milliliter caused a 60% drop in sexual satisfaction. What are the solutions? Well, you got to go to meds or checking for pituitary issues. High prolactin can lead to all kinds of undesirable issues in men. Gynecomastia, which is man boobs, decreased libido, and erectile dysfunction ultimately equals low testosterone. If your prolactin is too low, this may indicate that you have pituitary issues. The pituitary gland is not functioning properly, and it does require medical intervention to assess this situation. So I will briefly discuss testing protocols. The first one that is most important is when to test. You should get your blood panel done between 7 a.m. and 10 a.m. in the morning. And that's because that's when your testosterone levels are at their peak. And how often? Well, every 6 to 12 months normally. If you're on any kind of medical treatment such as TRT, you should be testing almost every 3 to 4 months to make any adjustments to the treatment, to make sure you're avoiding side effects and that sort of thing, to make sure that you're comfortable with the treatment as needed. Preparation for the test, you should fast overnight, the night before obviously, and skip the gym for 24 hours. As well, you should abstain from any sexual activity prior to the test as well, to make sure that the testing is accurate. A 2024 study proved that holistic testing, and holistic testing means getting the full blood panel, as I suggested, the 7 tests, and not just total testosterone. The study showed that misdiagnosis it declines by 50% because it's more accurate to get a total assessment with all 7 tests. So get the full blood panel done. So here's some guidelines for you. When you visit your doctor, you need to make this specific request. You need to tell him, I want a full hormone panel, which includes the 7 tests: total testosterone, free testosterone, SHBG, E2, DHT, LH, FSH, and prolactin. The reason why you need to specify this is because most doctors will not offer this unless you ask. So you have to be your own advocate. Regularly monitoring of your testosterone levels is essential for men over 40 to ensure optimal health. Knowing how often to test and how to interpret results can help manage testosterone-related issues effectively. So obviously we've discussed establishing your hormonal baseline, but that's just to start. Now we're going to talk about monitoring your testosterone levels for changes going forward. The frequency of testing can depend on individual health status and symptoms, highlighting the need for a personalized assessment. Generally, men over 40 should consider testing annually at a minimum, or more frequently if symptoms of low testosterone are present and persisting. So increased frequency of testing may be warranted if symptoms of low testosterone are present, and this ensures a timely diagnosis and treatment. Understanding your testosterone hormone test results is crucial. Healthcare professionals can help you interpret these results, taking into account your individual health history and your symptoms to determine the best course of action going forward. However, I will just mention this. Please understand that after analyzing your results, if you and your doctor determine that your T levels are below your normal age range, you do not have to immediately consider a medical intervention such as testosterone replacement therapy. There are several effective changes in your lifestyle that you can implement to restore your hormone levels naturally. And that is what I provide to you here on my channel. Knowledge is power. Testosterone optimization is not about guessing, it's about measuring. Regular testing lets you catch declines early so that you can plan to make the necessary adjustments to fix your deficiencies. You must be aware of the symptoms related to low testosterone so that you can take timely action to address these health concerns. Implementing the required or necessary lifestyle changes such as exercise and diet changes can significantly improve your testosterone levels and overall health. So there you have it. If you're experiencing any of the symptoms of low testosterone that I've discussed here, visit your doctor as soon as possible and get a full hormone blood panel done. You will need to establish your hormone baseline so that you can assess where to make the necessary changes in your lifestyle, your nutrition, your exercise programs, whatever is necessary to improve on your hormone levels, and then of course to monitor your changes as you go forward. Now, just a reminder, you can click on the link below in the description. I have a free T-boosting quick start checklist. So go there, you can get that for free. If this video helped, please click on the like button, subscribe, and drop a comment below what is your hormone struggle that you're dealing with today? So please join me on my own journey here to get healthier and live longer. Until next time, optimize your hormone health wisely and reclaim your vitality. We'll see you in my next video. Have a great day.